guys, welcome to Dental Classes for You. Today we shall discuss on a pharmacology topic, that is sedative hypnotics. This discussion we do here is actually based on an examination point of view. That is, we are learning certain codes and tricks so that you can easily remember certain tricks. Okay. Now moving on to what each term means, sedative and hypnotic. So sedative, what it simply means is something that calms the patient. It does not cause sleep, but it calms the patient. Sometimes it may make you drowsy. Now, hypnotic. Hypnotic is, on other hand, a drug that induces sleep or maintains sleep. Now, we will define each of these. So, sedative is a drug that subdues excitement and calms the subject without inducing sleep, though drowsiness may be produced. Now, hypnotic is a drug that induces or maintains sleep that is similar to the normal arousable sleep. Hope you understood what each term means. Now we'll move on to the classification. This sedative hypnotic group of drugs are classified broadly into three, that is benzodiazepines, barbiturates and non-benzodiazepines. Okay? Benzodiazepines, barbiturates and non-benzodiazepines. The main group of drugs that you have to remember here is benzodiazepines. Now, we'll move on to how they are further divided. Benzodiazepines are further classified into hypnotic, anti-anxiety and anticonvulsant drugs, which I have given a code that is HAC, that is hypnotic, anti-anxiety and anticonvulsant drugs. Okay. Now we will have to study examples of each group of drugs. For which each group of drugs I have taken 3 examples each and I have provided you guys with a code so that you can remember at least 3 of them. You can always read up more, but at least you have to remember some. That's why I am giving this code. Okay. So it says find old LCD. Okay. So from hypnotic drugs, examples include flurazepam, nitrazepam and diazepam, F, N and D. Now, in anti-anxiety drugs, you have old, that is oxazepam, lorazepam and diazepam. And in anti-convulsant drugs, you have LCD, that is lorazepam, clonazepam and diazepam. Okay. Hope I have made it easier for you to learn. So now moving on to barbiturates, they are further classified into long-acting, short-acting and ultra-short-acting drugs. In long-acting drugs, example is phenobarbital. Okay. Now, if you want, you can remember it like LAV. Okay. Long-acting phenobarbital. Now, short-acting. Short-acting drugs, you have 2 examples here, for which I have given a code BP, that is short-acting people will have high BP. You can think of it like that, okay? So the drugs under short-acting barbiturates are butobarbital and pentobarbital. Now moving on to ultra-short-acting drugs, there are 2 examples for which I have no code. You can make something up. It's thiopentone and methotrexate. Thiopentone and methotrexate. So now moving on to non-benzodiazepines, they are zopiclone, azopiclone and solpadam, all of which has the word zo in it. Zopiclone, azopiclone and solpadam. So that's some examples and the classification. Okay. I'll revise it once more. Sedative hypnotic group of drugs are classified mainly into benzodiazepines, barbiturates and non-benzodiazepines. Under benzodiazepines, there are hypnotic, anti-anxiety and anticonvulsant group of drugs, for which I have given the code HAC. Now, under each of these, we are going to study 3 examples at least, and for which the code is find old LCD. So, flurazepam, nitrazepam and diazepam comes under hypnotic group of drugs. Oxazepam, lorazepam and diazepam comes under the anti-anxiety group of drugs, and lorazepam, clonazepam and diazepam comes under anticonvulsant. Now moving on to barbiturates, they are in turn divided into 3 types, that is long-acting, short-acting and ultra-short-acting drugs. In long-acting, the example is phenobarbital In short acting, it is BP, that is butobarbitone and pentobarbitone. In ultra short acting drugs, they are thiopentone and methotrexate. Now finally, the non-benzodiazepines, that is zopiclone, esopiclone and zolpidem. Also, one thing you can remember is, in case of benzodiazepine poisoning or toxicity, the drug given is flumazelin. Okay, it's a benzodiazepine antagonist. Hope I have made this classification a little easier for you. For more such videos, like, share and subscribe to my channel. Thank you.